Start your video. Tell you see me, can you hear me? Hello? Yeah, good afternoon, sir. Rabindranath, sir. Hello, good afternoon, sir.
Can you hear
Can
me?
you hear me? Yes, I can hear you, sir.
Okay.
Uh, can you hear me properly?
Yes, I can. I can. Yes.
Okay, fine. Can you see, you can see me as well, right? I can
Yes,
see.
I can.
Yes, sir. So, all the best for the session,
Thank you
right?
so much.
And
We
technical,
will start by 2 o'clock sharp, right?
right, sir, right. Yes, sir. We can start by 2 o'clock.
Okay.
Yeah. So all the best.
Thank you
Yeah.
so much.
Yeah. Okay.
Hello, Saloni. How are you doing?
Sir, good afternoon. I'm fine, sir. Thank you. Sir, we are checking the technicalities also. So, am I audible to you, sir? Can you?
Yes, you are audible.
Thank you, sir. And all the best to you, sir. Right?
Thank you.
We will start
I
starting
think
by.
I
Yes, yes, sir.
sorry, it's been muted. So I need screen sharing options, I guess.
Yeah.
Hello everyone. Good afternoon.
Dr. Saloni, can we start?
So just 2 minutes to go. We can start at exactly at 2 o'clock.
Okay. Sure.
Yeah. Yeah. Then Omkar will start sharing the screen because अभी इनका है.
Saloni, I may need screen sharing option. Please give me that.
Start screen first. When you will speak, that time you can share your screen, sir.
Okay, thank you.
Yeah. Manchu.
वो भाई आमी को आगे ऐसी काटा तो मलिक ना आता दिया तो देखता अरे ए हट तो जिस करिए तो हाँ ये लकड़ी के यहाँ से कहाँ से जब काटी थी यार मुझे इसके काटी ना ये ब्यूटी काटेंगे ब्यूटी ब्यूटी चढ़ान दे अब उन्हीं को ऐसे चढ़ेंगे देख उसकी कट के जाएंगी इतना तेजी मारना पहले तू मेरा
Can you please mute yourself?
Hello. Hello.
Yes. Hello, everyone, and welcome to today's national webinar entitled Role of Hospital Administrators in COVID-19 Pandemic. I, Dr. Saloni Desai from Department of Hospital Administration, MGM. Registrar Dr. Rajesh Goel, Dean, MGM Medical College, Dr. Nar Shetty, and Director, MGM School of Biomedical Sciences, Dr. Mansi Thakur. Our panelists for the day are Mrs. Purnima Bhoi and Dr. Philomena Isaac, Medical Administrator, MGM Hospital, Kamote. I also welcome our acclaimed speakers, Mr. Ravindranath Biswas and Dr. A. Shyam Prasad, who will enlighten us with their talk. A warm welcome to all the delegates, all my dear students, and everyone who has joined this webinar. Now, Let us know more about the webinar. COVID-19 pandemic just few months back was foreign to us, and now it has already been speeded its roots well in India with 5.65 million cases and 31.7 million total cases across the globe. The virus is trending right now in almost every part of the country. Hence, mortality and morbidity across the globe is on a peak. Hospitals and other healthcare facilities play a critical role in national and local responses to emergencies, such as communicable disease epidemics. The healthcare professional needs to be protected against coronavirus so that they can save their people who are in critical stage of the illness. The global pandemic brought new challenges to the healthcare system, but it is also expose exciting issues, substantial medical related spending, high instances of chronic diseases, physician shortages, and a high number of preventable hospitalization were all present before the onset of COVID-19. As a result, healthcare reforms could be on the new horizons. Hospital administrator, various command team needs to be prepared for the implementation of the infection control and transmission measures dealing with a lot of training for the hospital staff, as well as coping with search for the resources, designing appropriate containment strategies. It's a complex interplay between hospital administration and the government along with the country's population. The hospital administrators, being the warriors in the forefront, are playing vital role throughout the pandemic and giving their ultimate best to save the valuable lives. Hence, this webinar aims to understand the role of the hospital administrators as a torchbearer towards this devastating period. It's my immense pleasure to request Director, MGM School of Biomedical Sciences, Dr. Mansi Thakur, to say a few words.
Good afternoon to everyone. MGM School of Biomedical Science is a constituent college under MGM Institute of Health Sciences, a deemed university graded NAC A, which offers paramedical courses for undergraduate and postgraduate for students who aspire to pursue their career in allied health sciences, teaching, as well as medical research. The MHA is a part of School of Biomedical Science as a department, and the main focus of SPS to encourage the students beyond academic education also, including evoking of leadership qualities, encouraging students for attending, participating in conferences, throughout provoking seminars, workshop, and taking up research projects as extracurricular and outreach activities. We all know that the healthcare is a complex and rapidly changing industry, and its administration can be complicated with all the industry's moving parts. As an administrator, need to coordinate with the pupil, the facility employee, as well as the pupils to it serves. Policy compliance, HR, finance, work process, departmental strategy, and even the data management are just some of the operations a hospital administrator oversees. So every hospital, clinics, and nursing homes needs a educated and trained individual working in the healthcare administrator jobs and hospital administration. They are also a key player to healthcare setup. Now, all we know that the pandemic has came in India in 2020 on March, just few days back only. So in this, the healthcare administrator plays an important role to fight or eradicate the novel coronavirus, that is COVID-19. So to keep this in mind, MHA from School of Biomedical Science has organized a national webinar on role of hospital administrator during the COVID-19 pandemic as a major leading role in patient care for healthcare industry. I pay grateful gratitude to our Honorable Vice Chancellor, Dr. Shashank Dalvi, Honorable Pro Vice Chancellor, Dr. Nitin Kadam, Registrar Dr. Rajesh Goel, and Dean Dr. Nashetti of MGM Medical College, Navi Mumbai, who always supported and motivated us to organize such a e-webinar for awareness, not only for the healthcare professionals, but also for the other professionals, students, delegates, and faculties. I'm really grateful to the speakers who accepted our invitation to be a part of this national webinar, Mr. Rabindranath Biswas and Dr. Shyam Prasad. I welcome all the delegates and my dear students on the behalf of MGM SBS. Hope you will all enjoy and it will be a learning session for all of us. I wish you all the best for your further proceedings and thank you for participation. Over to you, Dr. Saloni.
Thank you, ma'am, for your never-ending support and encouragement. We we are very thankful for an inspiration for all of us. Without further delay, I would request our student Tini to introduce first speaker, Mr. Rabindranath Biswas. Over to you, Tini.
Thank you, ma'am. Mr. Rabindranath Biswas is the head of medical operations at Motherhood Women and Children's Hospital, Bengaluru, with a wide experience in administrative and business operations skills. Endorsed his career journey with Panacea Hospital, Signature Senior Living and Care, MGM Hospitals, Fortis Healthcare, Curefit. He has also been certified as COVID-19 safety rules and procedure at the HCW by World Health Organization. He is also a freelance corporate trainer and is always interested in nurturing young minds. Sir will be covering the following topics. First, 20 parameters by Government of India and ICMR. Second, patient admission and registration protocols. Third, follow-ups and law book. Thank you. A gentle request to the audience. Please type your questions into the chat box of Ms. Kritika or Ms. Shreya Saxena and we'll bring up them after the presentation where we all have time for question and answer session. Thank you. Over to you, sir.
All right. Thank you so much, Kritika, and my sincere thanks to Dr. Saloni Desai, Dr. Mansi Thakur for inviting me for the session. Before I begin with the session, I would request all my participants to kindly mute yourself. It would be easier for all of us to understand and without any hindrance. MGM has been always so close to me, so it's been always good to be back to the college times and again either side of the panels, So that's really great. So today's topic is very, very crucial for most of us. Technically, if I say like most of the young hospital administrators who are going to start with their career. The only thing what I want to enlighten today is not only about the role, but how important is the hospital administrator in today's point of time, right? I 1 second, just give me a moment, guys. Okay. I hope you all can see my screen here. Okay. So So since 2020 March, I think as a India as a country, nobody
Sorry to interrupt, sir. We can't see your screen.
Okay.
Yeah.
Can you see now?
Yes, sir. Yes, sir. It is visible now. Thank you
Okay.
so much. Yeah.
So the whole thing is since the month of March 2020, neither the world, neither the country was prepared for such a huge pandemic. I think it is a history which we have created in terms of pandemic today. A very long time back, a Spanish flu has spread across the world, across the globe, and there was a lot of mortality which happened. Fortunately, this COVID-19 has not got into such a high death rate. But somehow, this COVID-19 has got initially, before WHO clears as a pandemic, it became an infodemic. Most of the rumors, most of the information which was disseminated, or most of the myth which was coming on the screens on the social media has made the virus itself so famous with the different kind of a concept. But I think with time, gradually from the month of March, today we are in the month of September, a lot of things have changed. People have become more educated, they have become more alert, people have become more knowledgeable about this particular virus, which is a very good thing. But we are not end with this. We are still combating in terms of fighting with coronavirus 2019. Before I talk about the COVID-19, and before I talk about the administrator's role, we need to understand something about our health economics in the country. It's very, very important because, as being an administrator, unless and then you don't know what is the exact health economics which we are dealing with it, what is the total GDP we are sharing with it, we won't be able to deal with it at a larger scale. So I don't want to make this session more like a classroom training. There should be a lot of interaction from your end. So just want to ask the participants who are attending, the young administrators, what do you think our GDP is right now in healthcare to be? You can just type your answers on the chat box. I can view the chat box, or you can unmute yourself and tell me. Anyone, any guesses? What is the current GDP for our health right now? Okay, so since I don't get any answers, I will continue saying this. So basically, you see, this is just a small write-up which I said like COVID-19 pandemic crisis is a reminder of the importance of investing in the healthcare sector for any country. It's how India has fared on this front and what it can be do to raise its health expenditure as a percent of its GDP, which is very, very important. There were times in India or in the countries, nobody has focused much on the healthcare or health ecosystem. Somehow they felt, especially coming to India, we have always negated the healthcare system as a least count of GDP. So if you see in today's time, as in India, if you see the healthcare system, what we used to spend earlier in the fiscal year 15, it was 1,008 per percent rupee. Today, in fiscal year 20, you see this has become 1,944 rupees per person, but it is still low. We don't think it is still meeting our expectations. The total expenditure by the center and states for fiscal year 20 was 2.6 trillion or 1.29% of GDP, which includes the establishment expenditure, that is salaries, gross budgetary, support systems, institution, hospital, and other central schemes like Ayushman Bharat and other more. Of the total public expenditure, the center shares only 25%. Over the last 5 years, the total public expenditure on health is just rising up by 15%. That is as per the compound annual growth rate. Much of this due to just pay hikes. Now, coming into this part, what other countries are doing and where are we landing up? India has total healthcare spending out of pocket and public is 3.6% of GDP as per OECD, in way the lower than the other countries. Now, if you see the other countries in 2018 was 8.8%. See the dramatic change, isn't it? Of GDP developed nations, where US is having 16.9%, Germany has 11.2%, France has 11.2%, and Japan has 10.9%. Spend even more. Okay, this is just I'm giving you around some figures which is there in 2018. Now imagine by during this COVID, how much they must have gone up with the GDP. India spends the least among the BRICS. That is, Brazil spends 9.2%, followed by South Africa 8.1%, Russia 5.3%, China 5%, with the public healthcare infrastructure stretched. Out of pocket expenditure in urban centers is high in India. The center spends less as public health and sanitations are on the state list. Today, in India, if you see, most of us are combating for bed. There are no hospital beds. There are no hospital infrastructure to combat this particular infection. Even consider your government setup, center setup, state setup, or your private setup. Everybody is fighting to get an ICU or ventilator because the country was never prepared for such crisis. Even today, we are fighting for one. Though perhaps people have understood that things will go normal and things will be fine by the hope stating that there would be a vaccination soon in the market. But understand, my dear administrators and my friends, this is not going to come end so soon. I didn't understand that. We are been fighting for this since pretty long time, and we have to fight for this. The biggest question comes to my mind: can investing in health boost the economy? India can boost its human capital's productivity by investing in education and healthcare, which has been least concentrated even today. In 2018, it is identified the poor public health as the 12th most important hurdle for ease of doing business, ahead of crime and tax regulation policy instability. Health and working conditions are key recommendation in its suggestion for labor market reforms. The health sector creates both high and low skilled jobs, can be used for pump priming the service and manufacturing sectors. What do we do in the post COVID era? India can raise its supply 8.5% of hospital beds, that is, 8 physicians per 10,000 people, to the standard of Japan and South Korea. Over 100 beds per 10,000 people. For this, a special designed fiscal stimulus can be funneled into a public health and policy bottlenecks removed so that the sector becomes the engine of GDP growth. Subsidized loans, earmarked land, single window approvals, tax holidays, etc., can be used for making medical devices and drugs and setting up hospitals. Now, coming to the major point: when the coronavirus outbreak, how India was combating. Immediately, the moment that China, in the month of December 2019, post their new year, the brook of this coronavirus happened. Other countries were in very lenient mode, stating that we would not get this infection. Unlike some infection earlier, which has not created a pandemic across the world, like swine flu or like SARS, which has come and gone at one point of time with a limited stage. But nobody was knowing that coronavirus is going to affect the country. The first thing which affected the country is the health ecosystem. Hospitals, nurses, doctors are overworked even today. The biggest role coming for the administrators is not knowing what to do, which is the challenge for every individual. Today, after 6 to 7 months, still hospitals are combating with the safety regulations. What could be the major reason for this? The only reason is that we are in lack of preparedness. Today, most of the hospitals, they don't know if there is an emergency, if there's a do and die hard situation, how would we combat this? A lack of preparedness. Second thing, the government was also not anticipating this virus will create a terror across the globe. India, which was the least affected country by the month of March, has come to the topmost now. Every second day, I, at my hospital, combat with the COVID-19 situation. Whoever it could be a patient or could be your own staff. How can we combat this? How can we prevent this? It's all on individual's hand. Understanding one fact, ladies and gentlemen, you have to understand doctors, nurses, paramedical team is overworked. You can't burden them with a lot of logistical work. It is only one, your role comes as a hospital administrator. Your importance plays a vitality, not only to give a support system to this existing system, but also to ensure that you keep your chain of transmission of infection broke through at one point. Why you think administrators are important at this pandemic time? Anybody has any answer to this? Why do you think? Why do we need an administrator? There were times hospital, nursing home used to function without administrators. Why today it has become important during this pandemic time? While the world is coming to terms with the magnitude of COVID-19 pandemic, with each country facing newer challenge, vastly different outcomes, persistent concern about the future, doctors and nurses have been making their way to COVID wards, each day and night treating patients, even as they fight their own fears. Today, if I talk about my hospital here, where I work, I see the fear is still there among my staff, among my doctors, among my patients, among my nurses, and my entire team. The fear is not about their own dear life, the fear is about their family members. What if I get infected? Who will look after my family? What if I become symptomatic? How would I take care of my kids? These are the common questions most of the people have, including the doctors, and that fear is lying upon. Today, if somebody complains that I have a cold or I have a fever, people have forgotten the viral flu is also one of it. Where people get normal cold, flu, take a Dolo 650 or a paracetamol or some antibiotic like azithromycin augmentin. Can somebody please mute this? Could you mute please?
Sapna Abhin. Thank you, Sapna.
Thank you so much. So the whole thing is today the fear is lying upon everyone. How do we combat? Do you think doctors have so much of time? Nurses do have so much of time to do that? No. It is you as an administrator who comes into the vital role. Your presence will bring up to this. But either way, in today's time, I see even administrators are really scared of getting into this hospital duties for because of COVID. Many people have even changed their profession because of COVID-19. They feel this is very unsafe. But let's not forget, there are other people who are working, also are human beings. They also have the family, they have the lives, they have the dear ones too. So, how would an administrator work in this thing? What would be a responsibility? The first responsibility of the hospital is the care of a patient. We should never forget whether it's a doctor, whether it's a nurse, whether it is your paramedical, housekeeping, front desk, or your back end office. Everybody is the secondary. The first is the care of patient. That's the major motto of any hospital in today's time. And it is crucial that during the pandemic, both COVID and a non-COVID medical conditions could continue to be treated. No hospital can say, no, it's a COVID, I would not treat. But there is a way to treat for this. You cannot treat a COVID patient in a non-COVID area. There is a dedicated zone for this while prioritizing the safety of caregivers and preventing them from contracting and potentially spreading the disease. Understand, as a hospital administrator, you also become a very important role here, not only just to ensure to care of patients, you have to keep your staff and doctors, nurses completely healthy. You have to ensure that they don't come under any sort of transmission of infection or they should not contract to any of these infections. As administrator working at a tertiary care hospital, we have to take on a huge responsibility of ensuring the safety of fellow clinicians, nursing staff, paramedical and support staff, and the society at large. Our response to the situation had to be made rapidly in order to stem the spread of the disease and in response to the government directives, which were themselves changing constantly as more information became available. Now, initially, in the month of March, when COVID has come up, okay, a lot of information were moving in because nobody was knowing about this particular virus. They moved in dramatically in terms of the health issues, in terms of the policy, in terms of notification, in terms of treatment, in terms of plan of medication, in terms of who has to be admitted, who has to be home quarantined. A lot of changes. Today, most of the people ask me why this lockdown has been removed when the cases are going up. Please understand, economy is also suffering due to the COVID-19. We have to take that also into consideration. What the government has done initially has made you prepared, made you aware, made you trained on the infection. The first thing, as an administrator, you have to tell your people, please do not get scared of this particular infection. This is an antiviral, but you cannot ignore either way. You cannot tell them that no, this is not just a viral flu. I can go around, hang around, go to the public places, meet people, meet friends, meet family. No, there are ways to take care of it. During this period, don't even forget you have a vulnerable crowd around, that is, pregnant women, newborn babies, small kids, and also the allied health issues which most of the old age people have it. In India, today, if you see, most of the crowd has either diabetes or hypertension, which is another vulnerable group, and every third house will have this particular case. It's very, very important. Don't get scared of COVID, but also do not ignore it completely. The very important thing as a hospital, first thing you have to take care is the infrastructural changes. It is very, very important. I cannot make my COVID and non COVID together. At Motherhood Hospital, we have also dedicated a different unit altogether for the COVID hospital, which has been taken care by separate team, separate doctors, separate nurses, and separate paramedical and a team of housekeeping. We do not mix them. This is our preventive measures. And as an administrator, you should always be very careful about it. And first thing, always remember, whether it's employees, whether you're patients, whether you're OPDs, whoever is walking in, ensure that there is a thorough checking done, which we call as a screening desk has to be done at your hospital. Without screening of any particular person, you should not supposed to get them inside. Whether it's a temperature or for say, if you want to do extra cautious, you can also check with a SpO2 as well. If any of these people who has temperature with a mild symptoms of COVID, which many of you want to would know about it, I think in the next session, Dr. Sham can tell you about it, few of the symptoms, you have to direct them to your flu clinic. Now, when it comes to a flu clinic, ensure one thing, your hospital flu clinic should not be present inside your hospital. Then that doesn't make any sense of demarcating a COVID and non-COVID setup. Your flu clinic or a fever clinic should be separately, where there's a different entrance and there's a different exit. It is very, very important. If you do not maintain this particular first step of guidance of infrastructure, you will land up spreading the infection across. Changes in infrastructure to ensure a complete segregation between areas providing area to COVID positive and COVID suspected patient include those coming in emergency medical condition. These were not only essential but have to be achieved literally overnight. Now, also we should not forget, a lot of people in emergency will also walk in. They will not go through your screening test. What will you do that time? You should also ensure that you get them tested at your casualty, triage, or emergency. Now, most of the people are also waiting for the RT-PCR report, which takes less than 24 hours. On the other side, hospitals are also ensuring to rule in few of the COVID guidelines. That is, to check the temperature, check the travel history, check other parameters which is set by the government. Few hospitals are also looking forward for Arogya Setu app or some state moved app which has also have the details of it. This challenges also compelled us to move towards a disruptive innovation without interrupting delivery of quality healthcare. So another thing as an administrator, you should also remember that whatever you deal, whatever you make, whatever changes you make, you should understand that quality of your healthcare should not degrade. You cannot make a shabby COVID hospital without any safety protocol. You can't keep the patient into that more deteriorated places where there is no sanitation, no proper care, there is no proper ventilation. It is important your quality of healthcare should be maintained, while the facility and management optimal utilization of infrastructure and manpower ensured an early sustainable level of preparedness. Now, very important, What will happen is when you develop a two different unit of your, in your hospital, a COVID and non-COVID, you will also see your manpower will also get divided into two. Or you, if a hospital feels to get a new set of people, that's a different story altogether. But your team should be prepared with a lot of things in terms of handling the patients, in terms of their own safety, especially with the housekeeping people. Nurses and doctors would know the protocols, specifically for the housekeeping, security guard, the grassroots level people who normally works at the grassroots levels, your biomedical engineers, they should be well known because they will be also interacting and moving around with the patient area. You should train them. There shouldn't be like somebody is positive and you're sending some of your staff and also they are contributing to the infection and they are landing into positive. It's very very important. At the same time, do not disrupt our on-moving areas. There will be a lot of OTs will go in, there are a lot of surgeries will be planned, and a lot of things will be taken. Very important areas which are like cohort areas, like those who are handling cancers, organ transplantation, NICUs, PICUs, ICUs, and trauma care. They are the more vulnerable patients. You have to take an adequate precautionary measures when it comes to an administrator's role. Managing emergency visit to the hospital came with the additional challenges as treatment could not be delayed or denied pending the availability of reports indicate the COVID status of patient. What would you do if suppose you even given a nasal swab test for an RT-PCR and the reports are taking time and you have to treat the patient at the same time you have to operate the patient. As an administrator or as a doctor's team may come and approach you for this, how do I go about it without this thing? You cannot stop the treatment, or perhaps the very important goal here it is that the moment you get this, check with the symptoms, immediately check with the symptoms of the patient, check with his status, check with his temperature and other required parameters again, and also ensure that you contact the lab where the sample is gone and ensure to get the reports a little earlier if possible, or also you can take a verbal report just to understand that the patient is positive and negative. One more a very important thing which a hospital administrators should take care. One is any emergency, especially for the tertiary care units, okay, where surgeries are planned, please ensure you get a fast track test done. You should be knowing your hospital should have two contacts. One, your contact of a report where you can afford to make a patient wait for 24 to 48 hours till the report comes before they move into the OT. Or you should have a lab type with you who also runs a single sample which can deliver a report within 3 to 4 hours. That is when an administrator role comes into it because it's very very important. We understand there's also charging included in it. A particular X company or a lab who is taking a sample and releasing a report in 24 to 48 hours would charge very nominally. But when you get into fast track, you should also understand the charges will go up. How would you deal with it? Patient would complain. I have already given a sample, I would not. Here, the administrator should make them understand why we would need this. At the same time, a doctor judgment will also be there, where doctor will tell, we need to operate a particular patient, we need a fast track to be done. It's very important. You have to also inform your clinicians how quick and how to prioritize these kind of cases. Very important is also other area that is creating isolated interventions in the air handling units and creating rooms with the negative air pressures. Most of the hospitals who have dedicated the COVID rooms or COVID isolated wards ensure the air pressure, ensure your air conditions, ensure your room condition is very favorable. I know India being struggling with the health economy in terms of pricing, in terms of costing, most of them will not be possible to do it. Exceptions are one or two hospital dedicated areas. But how would you make that area more better for your COVID patients and also to ensure that the infection doesn't spread out of the room? So there's one thing what everybody can do is infection for the working properly. So the very important, the 10 tips we have to remember if your hospital can create an airborne infection isolation room. One, verify the room sensors are calibrated and working properly. Very, very important. Ensure room controllers and monitors are working and communicating with the supply and exhaust airflow valves. Verify the room is operating at a negative pressure relative to surrounding areas. Ensure room pressure is being properly documented. Verify the correct air change per hour are taking place as per the CDC standards. Confirm the temperature and humidity ranges are in place per CDC standards. Verify room air has been exhausted directly outside through a HEPA filters. Ensure doors are being kept closed except during healthcare personnel entry and exit. Confirm patient rooms are visible on your building automation system. For prompt notification of any issues, consider updating older supply and exhaust VAV box to fast acting Venturi air valve or measure airflow valve. Plan for an influx of a patient, how to address isolation requirement in your facility. Now, to this 10, I'm pretty sure most of the hospitals will not have it technically because, again, as I said, there's again a cost involved into it, creating all those extra parameters. But you can also create within your system in the existing requirements, whatever you guys have it. This is a typical way an isolation room should have been, okay, where there's a supply venturi air valve, VAV. You can see there's isolation room pressure sensor here. You can see there's a door switch sensor, which again, because we normally avoid touching surfaces. Then you can also see the supply venturi air valve here again. Then you can see there's a room pressure control monitor, which you can see there. There's also an anti-room door switch sensor, again, just to ensure everything has been pressure controlled. Exhaust venturi air valve is here. You have thermostat sensor to understand the room temperature. Then at the same time, building automation system is also important that you can view the patient even if nurse or anything if there's a requirement. Now, the biggest challenge when you make this infrastructure challenge is one, which is a cost. Second thing, a patient's loneliness will also be a part of you. Doctors, nurses, and other paramedical staff won't be able to enter the hospital more or less into these rooms because they are more confined to the patient's recovery. Understand vaccines, medicines, there's no fixed treatment to get off this. At this point of time, patients' psychological status would change. Either they become very frustrated, either they would go very lonely because depends on the patient to patient incubation. The family is not around, they will be only virtually in touch through the technology. It's very, very important as an administrator, how would you engage them during this pandemic situation? Because understand, any patient who wants to get recovered, their psychological well-being has to be very strong and strengthening. Setting a separate screening areas and separate ICU facilities for COVID positive and COVID suspected patients require meticulous planning to ensure sustainable segregation between the areas. The very simple thing, ICU is the most critical unit, everybody knows that. At the same time, during this period of time, everybody also have to understand these units have to be thoroughly been maintaining its precautionary measures because the patients whom you're going to get, they will be either in a very critical condition or in a very vulnerable condition. Spread of infection, spread of cross transmission of infections very high. So it is always recommended if you have an ICU at your hospital, ensure you have a COVID positive separate ICU unit and a dedicated for suspected patients. You cannot mix them up together. If you do that, the chances of the suspected patient becoming a potential carrier of the COVID positive. During ICUs, there is a dedicated staff. You should also ensure that the staff are been allotted to ICU for longer term. Do not rotate the systems quite often. Second thing, most of the hospital in India is struggling for is with the protective kit. Today, PPEs, your N95 mask, your surgical mask, three-ply mask, your gloves, matic gloves, and rest of the airborne mask which is there, which have gone way higher in terms of expenditure. Hospitals are unable to get them on time because the demand is way too much. And India has lost that whole gamut of it. And understand, India is a country where these demands go up, prices also go up. hospitals are unable to combat that. So that doesn't mean that you would stop your supplies. It's very, very important. Administrators have to understand the criticality and the gravity of those requirements. When you see this is a case and a COVID dedicated center or a COVID dedicated ward, your team, your people should be wearing this and going, not entering into these premises without a safety gears. So when it comes to equipments, specifically when it says in hospital, you should also ensure your equipments as much as possible. If you can, whichever is can be reusable, it's always recommended. If not, a thorough safety CSSD has to be done. A thorough sterilization has to be done. Any equipment, whether it's a venti or whether it's your ventilators, whether your equipment which is touching your patient nasal or oropharyngeal or mouthpiece, ensure you get them sterilized. Do not cross-infect them. Their chances of cross-infection is more because the load, again understand, load of the patients will be very high if you have a dedicated COVID centers. Now coming to the next process is protocol and process. Now protocol and process have been variant state to state. Now coming to Bangalore, we always ensure if there's a patient or if there's a particular suspect, we get them as a COVID symptoms. We have to inform to our BBMP, which is your Bangalore municipality, and also KPME, again the Karnataka health websites, where we have to inform the local authorities. And also the best part is that these authorities get in touch with them to ensure how they're progressing. This is for the suspected. If it's a probed or if it's a very strong positive case, okay, a BBMP authorities or a local authorities would reach out to that particular patient. Okay, now you would say, how would BBMP come to know? Does the report goes from the hospital? Just to inform, ICMR have dedicated some labs across the country, and these labs are dedicated with ICMR registered labs. No lab can take this samples or COVID samples if they are not ICMR registered. It's very, very important. You need to know in case if you've been working in the hospital and if you are planning to start with a COVID samplings, please ensure that lab, particular XYZ lab, should be registered under ICMR. Now, when the samples have been taken, very important is the documentation. Ensure that particular patient gives his or her Aadhaar card, which has all the details, a copy of the Aadhaar card and also the details whom to contact, and to verify the numbers. Once it is done, the samples goes to the lab. Once it reaches the lab, it also ensures that to run the positive samples at least twice. They do not just confirm in one go. Understand, any lab, if you check any ICMR lab, they have to confirm a positive case twice. The moment the patient gets positive, the lab, the ICMR authorized lab, will inform the local authorities. It's not the hospital, let me tell you. So in case if you're working in hospital and you say like, oh, how did the patient come to know before I receive a report? Don't get shocked about it. It is just the government has been alerted by the labs that this is particular patient, this is a number, and this is the COVID positive report. Then you should, once the patient comes to know, first thing you should understand, patient will have a lot of anxiety and anticipation. And there will be a lot of worry. The moment you get a report in your confined zone, suppose in your hospital medical superintendent or infection control authority gets the report saying that's positive, first thing, do not market the report. Do not tell in the open forum. Reach out to the consultant or the respective doctor who has been treating that patient and inform the doctor that this is what the report is. Make sure the doctor reaches out to the patient and confirms that this is what the report is and compass the patient. It's very, very important to ensure the patient is in a very state of mind. Things is very important. They would get a lot of panic attacks the moment they get to say it's a COVID positive. Educate the patient by your doctors. Ensure, if it's possible, take the patient on the video call. The administrator and the clinician should be together to ensure you tell the patient what to do, what not to do, how to get quarantine, how sensitive, how serious it is. Though perhaps government authorities would follow up with the patients, how to go about it, how to take care, and also the state of condition. As a hospital, as an administration, and as an infection control team, you should also reach out to your respective patient because they have been diagnosed at your center. Another thing also you should remember, there will be chances where the patient might get positive, but at the same time, your own staff might have come up in contact with these patients. Also follow up with them. Don't forget them and don't neglect them. Understand, a contact tracing is also an equal important. And in reality, even I've seen in my own hospitals, a contact tracing is thoroughly followed. If you do that, you would be able to manage much of your cases well in time before it becomes worse enough. Creating and continuously refining updating protocols based on the time. WHO, CDC, ICM, and Ministry of Health will always update you with the recent changes. As an administrator, please ensure you are updated with the current trend. You cannot ignore them. The moment the current trend comes, you have to implement them in your current scenario, in the current infrastructure, in the current policies. Many of them have also forgotten the SLI and INLI, which is come up by the government, which is being ignored by many of the smaller startups. Please do not do that. This is again an initiative taken by the Ministry of Health and the World Health Organization. All these guidelines were centrally to minimizing the impact of disease, preventing the transmission of staff, patient, and their attendants, updating the modifying treatment protocols, reporting compliance to multiple government bodies, and analyzing data for research purposes. Understand the most important COVID-19 in today's time is not a recovery for anybody, but it's with a preventive measure one can get recovered. You should also understand we don't have medication. What they need is a supportive care. And we have to also ensure as administrator, you need to trace the patients or your sufferers who are getting suffering from this in the early stage before they get into a very critical stage. Today, India is still combating with the bed size, and we have to understand your local authorities have to be informed. Please do not ignore them. If your state has given you some sort of tool to update at the end of the day how many reports, please do not forget to do that. That is important not only for you, for them to combat the infection. This is very, very important, and administrator have to keep a very close watch, even for the WHO guidelines and CDC guidelines. You have to keep yourself updated, and also team of your doctors and clinicians should also know what is the new guidelines have come up. Then only we can work on this particular concept. Very important, the last and the final to end with is with the clarity in communication. Most of the infection happens, people get recovered, and people have also lost their life. But at the same time, as a team, as an administrator, or as a clinician team, should have a clarity in communication. If an X person has a COVID positive, very important, do not reform that person into a larger platforms. Do not go and tell people, okay, this particular patient has got COVID positive. Please do not do that. Understand, we have to maintain the confidentiality of that particular patient. Second thing, ensure your clinician knows about the status of the patient. Do not ignore your clinicians. They should know what's happening with their patients. They have to communicate with the patients effectively. Tell them, create that fear, remove that fear of the fear which they had created in themselves. That is very important. Most of the patients will only get recovered with a strong willpower. Specifically, with the patients who are very at the older age or who are with the younger age, a doctor, a pediatrician, or the geriatrics should know and inform the patient. There shouldn't be any delay of communication. Try as much as possible to reach out to the patient before they reach out to you. That shows a good practice in terms of clinicians and the healthcare. Do not allow them to reach out to you, say, like, see, I got a report, I am positive. It is not really healthy, but most of the time it would happen because most of the reports goes from the lab directly to the patients, and the local authorities alert them in the very small span of time. Keep the staff constantly motivated. The very important is in the hospitals, you have to understand the criticality of the staff. Do not ignore them. They are overworked in today's time, whether it's your clinicians, whether it's your nurses, whether it's your paramedical, whether it's a biomedical. Do not forget them. They are your forefront warriors for you. You have to get them motivated, and you yourself have to be motivated to motivate them. Do not give them the encouragement, give them the appreciations, acknowledge their hard work every now and then. They will do the best part of it. Understand they have also left their families and staying in the COVID centers hours and hours to serve the patient care. Ensure you adhere to all the protocols. Do not lay down any process. Please, it is very important. Any state level protocols which has come to the hospital, it has to be adhered. You are not only helping the government, you're not only helping the hospital, but you're at the large, you're helping the society. Allay the fears of possible breaches and the implication for healthcare workers and their families. Please ensure, as an administrator, you meet your team every day. Tell them they're doing a great job. Tell them not to be scared. Tell them not to be feared. I myself, I'm working in the COVID hospital. I go there with a lot of precautions, and I'm not scared because I know I'm doing the right thing, right way, and I know what has to be done. Despite the varied fears and apprehensions of heterogeneous group of people who fear contraction of the viral disease more with families in mind rather than themselves, this is perhaps the biggest challenge and the greatest learning during this period. Always understand, people who are working in healthcare, always educate your nearby people, your family. You should tell them, see, we are working, but that doesn't mean that I will bring the infection. No, if you are taking a proper preventive measures, you would never carry an infection. You would do a great job. Okay, so please do not get feared into this. To end the session, the final thing I will play a small video for all of you just to understand how you have to maintain your hospital at a par level. And very important before I start the video, also for all the people, when you do your clinical meetings, your day-to-day meetings, ensure you go with the technology. Do not conduct anything over on a physical presence unless and then it's a small group of crowd with maintaining as much of social distancing if required. It's a small write-up just to read out quickly. The life of a healthcare administrator is also constantly walking on the edge with expanded work schedules. They need to be constantly updated on existing and emerging data, which I've told you earlier, which also involve those involved in the decision making. Tackling challenges like restriction of movement, availability of materials, gathering additional manpower, ensuring travel safety of the staff, all require special arrangements. The third one is the ability to find some quick solution during this daily interaction was a true testament to the innovative abilities of every individual involved. We were able to organize emergency backup accommodation, provision for delivery of food and beverages, rapid rearrangements of shifts in order to meet the crisis. Even extremely unlikely scenarios were taken into consideration during the planning. For example, if a COVID positive mother needed to deliver with a very low likelihood of newborn also being COVID positive, arrangement had to be made for the newborn to be placed on a safer non-COVID area with specific protection for other newborns and neonatologists, especially if the newborn required NICU or ICU. Similarly, when the patient in the COVID ICU was critical and needed emergency interventions, the requisite equipment and expertise were made available within the ICU, thereby avoiding transfer of such critical patients to the operation theatre. The commitment from all levels of staff should be evident from their ability to assume responsibility beyond their normal schedules and your expertise. Flexibility in assuming different roles, often at short notice beyond the existing rota, was something that the nursing and junior medical staff handled with tremendous willingness and courage, which again I said, please motivate them for this and appreciate and acknowledge. Senior clinicians, administrators should also demonstrate an immense spirit of volunteerism. Lastly, it is important to acknowledge the role of government, both at the state and national levels, in bringing all experts and expertise from within the government and private entities, comprising clinical, academic, and research institutions, creating a national approach to diagnosis, treatment, testing, and tracing, reducing transmission through contact, moving forward with the same attention to details, planning and sustained efforts at every level, both clinical and social. We can hope that the casualty remains below what we feared. Our healthcare preparedness is very gentle, will be better. It's very, very important. The simple thing which I would want to tell people over here, the administrators, do not get scared. Your importance is very important to to run the hospital. Your importance is very important to make sure your team is working adequately with a lot of effectiveness. This is a small video for all of you. Just have a look at it.
Code green. Code green. Code green.
So thank you so much. This ends the session, which I would like to say: be safe, but don't be scared. Don't forget, we are the frontline warriors during this pandemic. Thank you so much.
Thank you, sir, for such a wonderful talk. I'm sure the participants have learned a lot, and with that, we will go ahead and take some time for questions. So the first question for you, sir, is how do hospital administration manages compliance with
Okay, so the first question you said is how do hospital administration manage compliance with laws and regulation during pandemic? Okay, now if you just to understand the question, what it means is you mean to say the hall compliances we have been doing before COVID. How do you manage that? That's what your question is. Shreya Saxena.
Yes, sir, absolutely.
Yeah. So see, now the whole thing is even we are managing all the compliances. Earlier there were time when we used to send documents physically to the government authorities, to the district health office and everything. If there's a communicable disease, when we have to send Form Cs and everything, still happening. Okay, but the mode of submission has become everything digital. Just for example, a few days back, I was been allowed to do an endorsement for my pharmacist, and what I've done is, um, when I called the drug inspector, he said, "No more coming to the office. You can just do it over online." So majority has become over online. So you please check with your regulator or regular authorities. Ask them how do we go ahead with compliance submission and finish it up. Now, that is one part of compliance you're talking about. Other part is in terms of fire safety and everything. This we cannot breach. It has to follow. So when you make an infrastructural changes, ensure you have to also take care of these compliances, which is also important by law. It is needed at point of time. Does that answer the question or anything else?
Yes, sir. Thank you so much. So the second question goes is, now things are coming out that corporate hospitals are reluctant to treat emergency patient without COVID report. On that context, as a hospital administrator, what innovation we can undertake for smooth emergency healthcare service?
Okay. I think this is a very wonderful question. I think we also face the same issue here. But what we have done, we have tied up with a lab who does a rapid antigen test. Now, just to reiterate, most of the doctors will not agree with this. Rapid antigen is not a confirmatory test, but at least it will make me prepared that if the patient is positive or negative, till the time I get an RT-PCR, at least I would keep the patient in a different area to begin with my treatment. So that is one which you can do. Either way, if you think if the corporate hospital are reluctant to take emergency care without COVID report, is because they would not have a COVID setup. Could be one of the reasons. Because even here, if you see two or three hospitals, they don't have a COVID setup and they don't have that much of adequate manpower. That could be one of the reasons. So only solution to this particular thing, Dr. Ashish Patro, is that we can always bring up a rapid antigen, which is again I would like to reiterate, it's not a confirmatory test. It is just an assurance if an antigen is positive or negative in your body. And if it comes to be positive, you can easily put the patient to COVID suspected zone and start treating them. The moment the RT-PCR report comes, you can move them back. Now, to reiterate again, it's a COVID suspected place, not a COVID positive place.
Thank you, Dr. Ashish Petro, for this wonderful question. The third question is, what is your first priority towards patients during COVID-19 pandemic? The question is from Mr. Mohsin Raza Naqvi.
Okay, so Mohsen, if you can just elaborate your question, what is your first priority towards patient during COVID pandemic? So first thing is when anything, if I understood right, please correct me if I'm going wrong. So first thing is the moment you see a COVID-19 pandemic or COVID, basically I understand if a COVID-19 positive for a patient comes, the very first thing is you have to make the patient psychologically stable. Very important. You have to reach out to the COVID patient in terms of either by call or either by whatever source you can, not in physical. Talk to them, tell them this is what the reports are. Please do. First thing is you should be confident to talk to them. Very important. If I go and talk to my patient and say, oh listen, you got a COVID positive, this will happen. No, you have to be very confident when you talk. So it's better. It's always a clinician talks with a lot of courage. They'll tell, okay, see, you got a COVID positive, there's nothing to worry. You might, now, also there are now two types. One is symptomatic and one is asymptomatic. The patient may come to you and tell, I don't have any symptoms, your reports are false. I would agree to it. It is a very common thing hospitals are facing through it. You can always tell them, you have to educate them. They are patients who are completely asymptomatic, without no symptoms. They're completely physically fit without any symptoms, but still they are carrying an COVID positive, COVID infection. So you have to tell them this is what it is. And then once then this is done, suppose if the particular patient needs an hospital admission, ensure them you tell the clinician to send, if you have a dedicated hospital with you or COVID hospital, you can obviously send them to that hospital. If not, you can tell them we are ready to help you. We will find out a nearest COVID hospital for you, which will be taken care by you. You can help them out. Obviously, this is again the monetary terms comes where they want to look into the budget and everything. Because again, if you're going to COVID hospital, the prices will go a little up because of the external usage of a lot of protective equipments which have come in, which have been charged to the patient. So there could be times. So you can always give them alternative. But the thing is, the first thing is you have to reach out to the patient, make them into comfort zone, break that fear fighter for them. You have to become a fear fighter and tell them like there's nothing to worry. It's just like an unlike like any other viral infection, you are having a COVID. Don't worry. Proper precautions, proper medication, proper supportive care. If you take it, you will overcome all this. So this will actually the first thing as a priority as an administrator you should be doing.
Thank you so much, sir. The next question is from Sanjida. Her question is, are we hospital administrators considered as frontline workers?
Yes, why not? Why would you think you're not? We all are the frontline workers. In today's time, COVID, it's not exceptionally going and saving army officials or CRPF people or people from some politicians. Nobody. Our own honorable chief minister in Karnataka has got COVID positive. So who are the people who are treating them? This is the team of healthcare workers And when I say team of healthcare workers, it's not exceptionally out that you guys are counted into it. Administrator, even the housekeeping, support staff, your front desk staff, your doctors, clinicians, everyone are part of it. So you will be always a forefront warriors for them. So don't always underestimate. This is a time where we all are a very, very important people, and we have to respect ourselves, saying like we are doing a great job.
Yeah. So we have our last question here. COVID hospital is taking non-COVID health conditions lightly at this time. What is your take on this?
So I think the question is from Deepti Kaushal. It's again a very wonderful question. Yes, COVID hospitals are taking non-COVID health condition. You mean to say a suspected condition? What can you elaborate the question, Deepti Kaushal? I'm not.
Sir, can I talk?
Yes, please.
Yeah, so I was talking about not suspected COVID conditions. I was talking about the other conditions which might be actually serious for patients, but we are not taking them into account that seriously. Like, for example, if somebody has to get a root canal done, some hospitals are denying it straight away.
Okay.
So that kind of conditions, I want to know what is our take as administrators.
Got it. Okay. So first thing we have to understand, by law, by Supreme Court's law, no hospital have rights to deny the treatment. First thing is that. Okay, but that's by law I'm talking. Now, hospitals who don't have COVID facilities, when I mean to hospitals, I'm referring to a small size bedded centers, okay, which might not have a COVID center or might be again inadequate of manpower. Okay. Now, a healthy person which needed surgery and without any symptoms, without any sort of COVID signs or symptoms, if I put him under COVID hospital and I treat them and I keep him under observation, the biggest thing is I would be landing up putting that particular individual into a complete risk, and also I'm making another chance of that particular person for the prone of infection. So I would strongly recommend that should never happen. A COVID hospital is dedicated for only COVID people, and this is very, very important because we cannot make a healthy person too exposed to the infection. You can dedicate the areas. That's another thing. If a hospital have a dedicated area, saying like the second floor is a COVID hospital, COVID ward, third floor is a non-COVID ward. There's a separate entrance. There's a separate exit for COVID people. There's a separate exit for non-COVID people. Then it's fine. Then it's completely okay with it. But if not, I would not recommend it. It's my personal opinion. Again, a hospital to hospital management differs, so it will be completely different overall. With that answer, Dipti Kaushal?
Yeah, thank you, sir. Thank you so much.
Thank you so much, sir. We have a few more questions, but then due to shortage of time, we'll be jotting the other questions and we'll mail it to sir, and we'll get back to the participants via WhatsApp or email. Thank you. To proceed further, now I request Ms. Kritika to introduce our second speaker of the day, Dr. A. Shyam Prasad. Over to you, Kritika.
Thank you, Tini. Dr. A. Shyam Prasad is a medical officer in Apollo Hospital with more than 15 years of experience in managing healthcare business. He is a medical partner of EMRI, that is Emergency Management and Research Institute. One of the key persons to implement emergency management services in Andhra Pradesh, associated with in 5 different states in India, spearheaded large strategic projects of multi-site scopes and startups. Topics which will be covered are real-time scenario in handling COVID-19 patients, such as role of healthcare administrator in quality management of hospital, infection control, handling change in parameters. Thank you. Participants are requested to put their queries in the chat box of Ms. Tini and Ms. Shreya Saxena. Over to you, sir.
Thank you for the introduction,
Sir?
Kritika. Can you all hear me?
Thank you, sir.
Can you all hear me?
Yes, sir, you're audible.
Yeah, thank you. Thank you, Kritika. Let me share my screen. Thank you, Ravindranath, for giving us uh, the information on protocols, process, and other aspects which we need. So my presentation is, can you all see my screen?
Yes, sir. Please
Yes, sir.
please put it in the.
So my presentation will be practical oriented. Ravindranath has given all the theoretical knowledge of what we need, and I'm going to highlight what we have done and what are the practical things which we have done, which healthcare administrator need to implement in the hospital. So what I'm going to cover is the role of healthcare admin in quality, what he need to do, how to control the infection, and there are different parameters changing every day. How did we handle? And if time permits, I'll give a couple of scenarios of how how to expect that, how we can get certain situations in this pandemic. So, what is the role of quality in of a healthcare administrator? So, the whole thing before pandemic and after pandemic is changed. So, the processes need to change. I mean, the processes from the patient entering the hospital until the patient leaves the hospital. Everything, the daily activities, the phlebotomist, the nursing activities, the OT, the staff, whatever they are doing, every process need to be changed. They need to be they need to be handling these COVID patients. They need to be handling the preventive measures, coming to washing or sanitizing themselves. Everything, each and every process needed a change. So that's a big role in quality department to ensure, to change and implement all this process and to make, to let the people and the hospital staff know that these are the change in parameters and we need to adhere to them. What else we need to do? Frequent audits. What we did is frequent audits, whatever the change process or things which are being done for this COVID, we did a frequent audit, I mean, frequent rounds in the hospital to see all this compliance for COVID is being maintained. So this is the only way to ensure that everybody knows what is the compliance and everybody needs to maintain the compliance and everybody need to adhere to the protocols and process. New quality indicators. So as you know, every hospital has their own quality indicators, but this pandemic has affected the indicators badly. So we need to exclude them. We need to exclude these patients, and we need to implement new quality indicators to see how our quality of COVID patients and to other departments as well. Here we have COVID. We have mother and health called cradles, and then we have spectra, which has a surgical branch. But we imply on lot of indicators uh, coming from breast milk to hospital infections too. But everything need to be changed. We have to implement new quality indicators in order to comply these quality. And infection control. That's a total different topic where I'm going to explain in the next slide. So how we control the infection, how we prevented the outbreak of COVID in this hospital, and implementing the COVID questionnaires and forms. Right from the quality starts from the patients right when they enter the hospital. We have introduced a COVID questionnaires forms, and we have to add several consent forms, COVID consents, uh, to be implemented as per NIH or for our own hospital safety to see whether patient is not lying. I'll say why a patient is lying when they come to hospital. They want to have a treatment, right? So when they want, if they have fever, the hospitals are not trying to admit the patient. So what they do, they take a paracetamol and come in. they cheat the infrared thermometer, right? So all these things need to be addressed. So if one patient is entering the hospital who has COVID and is masking the symptoms, it is not only going to affect the whole hospital staff, but also the other patients as well who is in critical condition. So that's why we have to introduce these questionnaires and forms to, to protect ourselves and to protect the patients as well. Surveillance screening. So what what so after this pandemic, when the pandemic started and it moved for a couple of days, couple of months, and then like 6 months, then we wanted to know how are we doing, how is our outbreak. So we conducted a antibody screening levels to all the patients, and the reports suggest that almost 10 to 20% of the staff are already having antibodies. So that indicates how, even though we have, how we, even though the staff is being infected, how we control and how we made sure that our hospital is safe environment. Cohorting is one important quality measures which need to be implemented in every hospital. As Ravinat already mentioned us that regarding cohorting in his slides, but what I want to emphasize is we have divided all the staff into different groups: OT staff, OP staff, inpatient staff, and we made certain cohort teams that one group of team will not interact with other group of team. That's how we stop the infection spreading from one place to another. If there is an outbreak, we can immediately, quarantine one group, and then the other group comes out and takes the thing. So cohorting plays an important part in maintaining the quality of the hospital during this pandemic outbreak. Quarantine rules. There are several rules and regulations, day to day changing every day. Government says one day and then it changes the other day. When it came first, it is 21 days or 1 month. Now it is like each and every state has its own quarantine rules. So we need to change, act upon everyday changing rules, and for that, what we did is we created a red book. So in the red book, we implemented all the process, all the things, all the preventive measures, safety measures for all the patients coming to our hospital. So on this red book keep changing from day to day. Every time it is an update, the red book is updated, and then we are able to move. And then this red book is circulated to all the people to know what has been changed, and then this helped a lot to maintain the quality in our system. And lastly, we have to take care of our staff. Masks, shields, face covering, other measures are important, but also we have provided extra support to the staff, and we have have provided extra care to quarantine facilities. We have provided a place, supported the staff who doesn't have families into a separate center, and then we have supported people who are in doubt, who are in direct contact with the COVID patients, COVID relatives or patients, into a separate facility. So taking care of the staff is also one of the important role, because during this pandemic we faced severe atrocity of staff and doctors. So these are the main things which we there are a lot of things according to the book, but what we implemented to adjust the quality. And all these points will come again when I'm trying to explain a scenario or the control measures, how we control COVID. So as I said, how we control infection. So the stepping point, right? So at the door, we implemented the sanitizers and infrared screening, right? patients are as wise too, right? They started coming, taking paracetamol. They are trying to mask their symptoms. So, but they can't mask smell and taste. So we implemented smelling of spirit, and we implemented smelling of coffee beans, right? And we were able to identify the non-symptomatic COVID patients who had like taste loss or smell loss, who lost the smell and all, and we are able to tell them that you are having symptoms of COVID, and then if it is not emergency, he can wait. If it is an emergency, we have COVID hospitals, and we shifted the patient, or we reverted back to the hospital which can treat COVID patients. What other we did for the receptionist and the staff? You see our nursing station, you see our doctor station. It's been completely proved with the cabins. The cabins looks different now. It is protected, and then with all the N95 PPE kit and face mask, we also implemented these kind of structures to prevent the spread of uh, uh, the COVID spread from patients to our healthcare workers. So what other things for infection control? Regular preventive measures, as you know, washing your hands regularly, washing. We instructed the housekeeping to wash the handles, lip buttons, and common areas, restrooms, to be cleaned every 2 or 3 hourly. And then second thing, identify the symptoms. So it is very important that everybody in the hospital, from the housekeeping to understand the symptoms, so that they can report and they can get evaluated. It is if you can't identify the symptoms, or if you take it light as simple flu, it is going to spread inside in the whole hospital, and it will cause an outbreak. So we have to we trained every staff about symptoms and the preventive measures, so that we kept the infection under control. We implemented paperless registrations all times at all places, morning, night, whenever the patient comes, it's all done online. It, we have not handled any transactions between patients and then from the billing area. And all the admissions and billing are done sometimes on the bedside. The first priority is the patient comes in. If, for example, if the patient is a pregnant patient, and we are screening them before in their third trimester, and then we are making sure that they are COVID patients. If they are emergency, we are as as you all know, we can never deny, we can't deny a patient from getting the care. So all we need is, if the patient has COVID, we have separated different floors for patients who has done RT-PCR, and the patients who are not able to do RT-PCR test. We have separate floor for them, and then we have full PPE kit for all the people in that floor, and then we try to address admission and billing at the bedside of the patient. And we supplied N95 mask, respirator shield for all the people. Respirator is mainly for the anesthetist. If you see, if you consider the OT area, which is more the OT technicians, anesthetists, they are more prone to COVID, because they have to intubate at times, and it's a closed circuit area. The aerosol are higher in that OT area, so they need to have proper protective equipment to protect from this COVID. So we have given respirator for people who need ENT anesthetists who are in need, and others we have provided proper PPE, N95 masks to protect themselves from this COVID patients. So if you see the PPEs, this is the new code. Now each hospital has their own color code, own dress code. You see, it has become universal now. every healthcare worker has been, we have seen them in PPE. They are protecting themselves, they are protecting their own family. At the end, they have to go to their houses, they have their kids. So we are providing them with these PPE kits so that they protect themselves and others from infecting with from COVID. So what else we did? We decreased the discharge timing. So because the longer period of stay in the hospital, the longer they get infected too. So what we did is we shortened the time, and then the discharge summaries we got ready before, and then at the time of discharge, it's been done everything in the bed, and all they need is to go from their room to outside. So, and we have created uh, separate entry points for fever patients, and we have implemented separate fever rooms, treatment rooms for the people who are having fever and the symptoms of COVID. So these are all the steps which we took care to control the infection. And then doctor rounds. We implemented fixed times for the doctor rounds and fixed times for the families to visit their people, because if you see like a patient who just delivered, it is a joyful to the whole family. All the family members wanted to see, right? So we can't allow. We just allowed one attendant with them, right? We decreased the hospital stay. We discharged if there are no symptoms, and so that and we have separate uh, time place for the families to meet their patients. The next thing is the education leaflets, the information leaflets. So we stopped all the paper to be distributed. We out we used PDF files to send to now everybody has their own phone. So we try to communicate with their PDF files and WhatsApp, different kinds of apps to give our information to the patients. And even the diagnostic reports, we made it online. We stopped giving out almost 95% of all the reports straight away into their inbox. Uh, some reports which cannot be are being handed over in a proper way. What else we did? Housekeeping. We know that the hospital staff and all are well versed with the precautionary measures, but housekeeping and other maintenance guys, accounts department and other departments who are in the hospital are also a part of hospital who come and go, right? So we have to have separate training for them, and we have to created separate kits if needed for them. For example, housekeeping, they used to enter multiple times in the patient's room, which increases the mode of infection from patient to the housekeeping and or from housekeeping to patient. So we decreased all those, created a kit so that uh, everything can be done at one shot, and we created assurance to all the hospital staff. We said that if anybody is infected, our hospital is going to take care of it, and we will provide all the healthcare needed for all the people. And we also started providing services for the patients to pick up and drop where they don't have their own vehicle, or they don't have anybody to do. Then we have our own services, which is well maintained from this infection control, where we can drop and pick up the patients at the time of need. So and with this training and all, we inform the staff to report the any person or anybody who is infected with symptoms. So this can only happen when they are properly trained, and we give an assurance that reporting the COVID infection or the symptoms is not a big thing. It is for our safety. It is for our hospital safety. It is to prevent an outbreak. And this helped a lot because the patients are staff, the other maintenance staff, healthcare staff are being encouraged to daily check their own people and then report if there are any symptoms noted in their team. So that helped us to quickly identify quickly identify the primary suspects and then secondary suspect, and also helped us to quarantine people who we suspected. The last thing is the outbreak comes, patient goes out. The healthcare might stay at the patient, but the people, family members in the healthcare, they go out and come because of they have to do their own job duties, right? So they might get infection from outside. So when they get these kinds, then we quickly identify who they contacted, the primary contacts, secondary contacts, and then we quickly quarantine them, and then that's how we try to stop the outbreak. So, what are the change of parameters and how did we handle it? So, infection control, and that's not only the issue, but there are change of parameters. For example, uh, at first when they said hydroxychloroquine is the thing which helps you from COVID, so we started giving hydroxychloroquine to all the people, healthcare people need it, right? So then after sometimes the research-oriented evidence-based medicine said not necessary, right? Because they have other side effects. And we came to know that the natural elements like vitamin C and vitamin D, which are immunoboosters, and then zinc, which can slow down the replication uh, in vitro process.
Excuse me, Dr. Sham,
Yes.
please, one request, please little be louder so that we can hear you properly, sir.
Right.
Thank you.
So we have implemented zinc and vitamin C, vitamin D. We ensured that all these healthcare people got these immunoboosters and then multivitamin tablets necessary. We also educated them to take these uh, these vitamins and all in their food as well. Uh, we educated them which foods have vitamin C, vitamin D, and zinc, and then we advised them to have it regularly, and we advised uh, to maintain their health as well. So the change in parameters, like the it is changing every day. It is we have issued 26 to 30 issues volumes of red book till now. Every day there is a change, and we implemented that change at the earliest, and we also trained the staff and healthcare on these changing parameters. So one more thing which we faced is the government said quickly. Some of the state government said we need to provide 50 beds to COVID patients because the COVID patients are increasing. How do we handle it? We don't want to bring a COVID patient into a healthy clinic and infect all the people because, for example, other specialties is okay, but when you are talking about mother and child. Uh, People wanted their baby in a safe environment. So what we did, government said it is must to have 50-50 bedded hospitals. So we took a couple of hospitals in our, we have 3-4 branches in our state. So what we did is we converted one couple of branches to COVID centers. We started treating only COVID patients in there, and we started treating all the healthy patients in other place. So we did we did give the number of beds asked by the government by implementing one COVID hospital, providing full COVID services in one hospital and providing full non-COVID patients in other hospitals. But we still get emergency, right? We still get it. So that's where the testing showed up, and then we identified. And even though if there is a COVID patient in emergency, we never denied. We took them. We took proper care, wear proper PPEs, and then treated the patient, and then again we disinfected the areas where the patient is treated, and then came back to normal. So this is a new normal. So these change in parameters need to be noted, and then according to state, whatever the government norms, and we need to implement that. So age factor, right? So one at first it says everybody is infected, and later it says 60%, 60 more than 60 years of people getting more infected. So we started taking more care for the people who are having aged in our hospital, and some of our healthcare providers have some immunodeficiencies. So we have taken extra care, make sure that we didn't involve them in the places where there are risky situations. Quarantine rules change from country to country, state to state, right? WHO provided something, government of India provided something. After that, state government released some norms. So day to day we have changed our parameters accordingly, and we implemented the quarantine rules according to the state, and sometimes we implemented quarantine rules to our own hospital also, even though the government released now. This is only to safeguard our own patients, and the patient safety, and the staff safety as well. So the quarantine rules first, they said like 21 days in the beginning, then it came to 14 days, now it came to 7 days. We identify the primary, we quarantine it for 5 to 7 days, that's the incubation period, and then later when they have no symptoms, then we will again do RT-PCR if necessary if they have symptoms. If there are no symptoms, they are again coming back into the same healthcare clinic. But if they have symptoms, they have to undergo RT-PCR, and if they are infected, they are being quarantined, they have been provided proper facilities, and after 14 days, again the health staff has been retested for the COVID disease, and then taken back into the system. So we have changed the work rules and quarantine rules based on the government norms. So forms, as I said, we implemented new forms. We implemented COVID consent forms. Patients, because there is all if a patient come to our hospital and they get COVID infected, right, and then they can clearly said we didn't have infection, and the hospital provided infection. They can always go to a court, right? So we made sure that they concentrate, people they tell about their travel history, they tell about their symptoms, and we started taking consents because it matters, because we need to protect our staff and family. And as I said, Red Book updates, we update like around 26 to 30 times. Whenever there is a change in parameter, it's not only a update, and it should be spread to all the people, and it also need to be trained of what is needed to be updated. So I think I still have time. So some of the scenarios, what has been faced in our hospital during this pandemic, right? So the patients are, it's a pandemic, and patients are not willing to come to the hospital. So, for example, if you take mother and child health, right? So pregnant women need screening in their first trimester, right? So, and they have the period of if you find any anomaly, we need to terminate we need to terminate, or we need to do additional steps for the mother to ensure they have a healthy baby. So we have seen that mothers are started coming after the time, after 3 months, after 4 months, after 5 months, missing the period of their anomaly scan, missing the by quadruple marker, by bipolar marker, quadruple markers. So one of one such case which I came to know, that the patient came and we suggested for all the scans, but it is they denied and they didn't perform, but they ended up having a baby with Down syndrome. So all this resulted in like blaming the doctors and the hospitals, right? So these things need to be prevented, right? So we have our own particular process and we implemented the things that whoever comes in the late in the trimester, we have to screen them properly. If they miss a bipolar marker, we implement the quadruple marker, and then we implemented the anomaly scan, and people started even started doing doing the scans for the last trimester, and we have seen certain scenarios where the baby's position has been changed and ended up in emergency. So, so we implemented certain things, procedures to based on these to quickly assess the mother, and then we say we gave assurance to the mothers that it is for their safety, for the baby safety, and because it is the pandemic has not only impacted a short while, because imagine a parents having a child with anomalies and they have to they have to face that for the rest of their life. So these kind of scenarios has taught us how to implement and make the procedural change to safeguard our patients. Second scenarios, we get COVID patients, and one of the other hospital staff may get the COVID positive, right? So after 14 days, go for RT-PCR, again positive. After 7 more days, go for RT-PCR, again positive. The, the dead viral load is still in their throats, and then it's causing repeated RT-PCR positive. How did we handle? So these things is still happening day to day. Some people are having a long time disease with this COVID, but they might be asymptomatic. Some people are having severe disease. They might get from the asymptomatic patient. So we implemented a process. RT-PCR is the gold standard, but repeated tests, even after 21 days, we are doing antibody tests. The IgM antibody, which stays for 21 days, and then IgG, which stays after, right? So if they still have the IgM antibodies, and that means he's in active infection, so we are not letting them come in. So we repeated tests. We are making ensure that our health staff, hospital staff who has been positive has been repeatedly test and make sure that it is safe and safe, and then only we are entering them into the hospital. And then handling emergencies, right? So for other patients who are not in emergency, we are treating them. We are getting them RT-PCR done at in the 2 weeks before, 1 week before, or 2 days before, and waiting for the report for 2 days. But in emergency, the best thing is to do an antigen test. It is not a specific test, but it is sensitive. We don't. If it is positive, then we know what to do. If it is negative, then still the patient is considered as COVID patient, and all PPE is being all the hospital staff is provided with PPE, and we take care of the emergency, and then later we get the results of RT-PCR, and then we'll see whether the patient is positive or negative, and then we have to go accordingly. So these are the scenarios which you can get while you are in the hospital, and each scenario has its own permutation and combinations. We said all the patients will get an RT-PCR test before joining hospital, right? It is not practically implemented, right? So because patients can have emergency, patients can come, and we can't deny. So we implemented antigen test. Sometimes antigen test is negative, and then RT-PCR are positive. We implemented certain process to take care of those kind of scenarios, and sometimes patient is positive before, and then they come, and we can't just deny the treatment, right? So we implemented, we checked their antibodies. So tests handling the emergencies, different scenarios are being very important as a hospital administrator to provide a quality healthcare for all the people. So these are some of the quality measures, then infection control measures which we have taken in our hospitals to prevent the COVID spread and to prevent the outbreak in our hospitals. Thank you. I would like to take questions and then.
Thank you, sir, for such an informative talk. It's time for a question answer session. I request Dr. Saloni to take the charge of the same.
So I think some of the questions are being answered by answered already.
Yes, sir. And so I would like to thank you, Dr. Sham, for such a wonderful insight into the session, explaining the role of quality, the process, the audit, the quality indicators, infection control, the staff care, about the PPTs, the registration process, change in parameters, billing, and the quality indicators, which you have very well explained in your session. And there are many more questions, but I would like to ask one question that is by Noshin. And what Noshin is asking, that some patients or their relative doesn't follow the social distancing norms. And you see them often removing masks while also even in OPD. So now her question is how to
Yes.
deal with such kind of patients, sir.
Notion, yeah, they don't follow. Only one thing is repetitive, telling them, reassuring them that it is for their own safety that we are asking you to wear this. And repeated, repeated rounds auditing helped us to educate the patients. As soon as the patient enters, we are educating them that it is for their safety to wear the mask. So we educate them and then we reassure them that wearing a mask is the only way to control the disease. That's how we are dealing with patients and making them combat compliance to our norm. The question from Sherlyn is, sir, what are the ways in which the administrator plays their role in combating the fear of COVID-19 patients? Great role. As we say, we are, when the patient comes in, they are not directly going to a doctor or they're not going to any other. They just come in the first place where the security, where we take them, right? So we ensure them that the hospital is, we have all the precautions to prevent this COVID. And then whenever the care manager comes in contact with them, whenever the administrative, they reassure. Reassure is one important role that we can combat the fear of COVID. And we have to show the patients that the preventive measures that we are taking in the hospital that would reassure the patients come out of this fear to battle this COVID. Question from Deepthi Kaushik. COVID hospital is taking non-COVID health conditions lightly. I think this is answered. We are not. That's what, right? So we are not. We separately, treating COVID and non-COVID patients. In fact, we are doing as good as we are doing even before COVID. So we are not taking those conditions. And if you need any help, our hospitals are there to help you in any kind of. We provide all the services. We never stopped any services or we never denied any treatment to any people. So is preventing COVID worth sanitizer risk? Dr. Sweta, I didn't understand the question. Can you please retype it? Question from Sweta. There are so many hazardous impact of hand sanitizers on human body, especially skin. So, okay, now I understood the question. So, skin is sensitive to some people, right? So, compared to the side effects of the sanitizer on the skin, we found that it is better to use sanitizer than to worry about the impact of hazardness
This is the
of
question.
sanitizers on the
PPE kit.
hands of your on
PPE
hands
kit.
of the
Read the
people.
question.
So why? Because it is you have some bacteria which are on the skin, that is understood, but we we should worry more about the pandemic, which is more dangerous than what you have. Later, if everything is become normal, the same thing, we can have the normal life, and that can bring your thing back. But if you want away from this hazardous impact, you stay home, stay safe, or use barrier methods rather than sanitizers. That's all I would say. What is your first priority, patients towards COVID pandemic? Uh, Safety, prevention, precautions, those are my first priority towards patients of the COVID. I think the other questions have been answered. Let me see if there is anything in chart.
Hello,
Yes.
Dr. Sham. The question is from Aman Namdev, and he's asking about, can COVID-19 be caught from a person who has no symptoms?
Yeah. COVID patients with non-symptoms also can spread virus, not effectively as the patient who can spread virus. For example, patient who coughs can spread the aerosol to a longer distance to and more number of virus. Patients who are asymptomatic, they are patients, right? How do you know? You take a swab from the throat, right? So the swab from the throat shows that there is virus. So he can speak, right? He can speak. You can share the food with him or do anything, right? If you are not maintaining the social norms, then yes, you can get COVID from a non-symptom patient because the virus is still there in his throat unknown. How to deal with the PPE kit shortage in hospital? We we this has been a common point in a lot of hospitals. So as soon as the pandemic started, everybody knows that we have a shortage of masks. Then and there, we as hospital administrators, we listed out all the important points, and then we made sure that we have it in stock. Whatever we need, we have it in stock for the next 15 days. We are not taking everything from the market, so that it is not been available to the market, but we made sure, because healthcare people is important, so we made sure from the first primitive days of this lockdown, we had never had a shortage of PPT kits in our hospital. We made a list. We make sure that the list need to be we did frequent audits so that we never had a shortage of any PPE kit in our hospital. That's how we did it. Sir, what difficulties are you facing as an administrator during this COVID situation? One difficulty which I would say is the healthcare people itself, doctors, right? So sometimes the doctors are because they are not following the norms. They come, they don't get checked because they are the doctors. They know it, right? So we implemented in such a way that whether it is the CEO of the hospital or whoever it is, doctors, thought doctors, patient who is VIP, doesn't matter. Everybody need to go through the screening session, and everybody need to answer all those questions. That's how we implemented. We prevented the outbreak of COVID, and in that process we faced it.
Yes, thank you, Dr. Sham, for explaining each and every question so elaborately. Now, I would request our next session, that is, uh, I would like to introduce our panelists of the day. Mrs.
Mrs.
Purnima
Purnima
Bhoi.
Bhoi.
Mrs.
Mrs.
Purnima
Purnima
Bhoi,
Bhoi,
she is a
she is a
PhD
PhD
scholar in
scholar in
management,
management,
quality and
quality and
patient
patient
safety,
safety,
and
and
MBA
MBA
Health and
Health and
Hospital
Hospital
Management from
Management from
Indian
Indian
Institute of
Institute of
Health
Health
Management
Management.
and Research, University that is in Jaipur. She has an experience of around 11 years working in various portfolios, including the hospital operations, quality HR, corporate relations, training and capacity building, internal auditing, and implementing ISO and NABH. Her areas of interest are quality and patient safety, hospital operations and process improvement, NABH, and accreditation. Now, I request our panelist, Mrs. Purnima Bhoi, to give us valuable review about the webinar in short.
Well, first of all, I would like to extend my thanks to Dr. Saloni and Dr. Archana for giving me an honor as a panelist in this webinar. And good afternoon, all the invitees, all the speakers, and all the participants here. As we know, the entire world is fighting with the COVID-19 pandemic, and every day, each and every country is facing newer challenges with different outcome and persistent concerns about the future. Like what all the healthcare workers are making their way to treat COVID patient while fighting and coping their own fears. So, as at this point, as an administrator, my point of view is like most of the point technically and practically has been already discussed by the eminent speakers. But I would like to highlight some of the things because lot many students are here who are into the domain of healthcare administration, and they are going to be a hospital administrator in the future. So, as an hospital administrator, one's responsibility is, of course, prioritizing the safety of the caregivers. And in today's scenario, the patient safety is the major concern of all the quality-oriented providers. And we have to prevent them from contracting or potentially spreading the COVID-19 disease. Okay, so apart from all these, what as an hospital administrator, what we can do? Our response is to, is to adhere and follow the government directives, which are changing constantly, and every day new informations are coming up. This has been already highlighted by Mr. Ravindra, and few of the points like infrastructure changes. This was also highlighted. We have to segregate the areas where we have to take the COVID positive patients, and we have to take the suspected cases. Then we have to deal with the normal patients. Okay. Then emergency was highlighted that we have to deal the emergency patients with where the patient treatment cannot be denied or delayed. The challenges there as a hospital administrator there in emergency is, you have to wait for the COVID report. Okay, those for the patient, those who are suspected for COVID-19. So that waiting time, why, how you are managing your patient in emergency, that matters. Okay, and the next point I would like to highlight is the ensuring availability of materials. I could see lot many questions are, there is a lack of PPE supply, how to use and how to ensure that there is a proper supply of PPE kit and mask. So as a hospital administrator, our duty is to ensure the availability and appropriate use of PPE and N95 mask. I think the second speaker has given some practical aspects on this. I would like to add one more thing there that, nowadays the government is focusing and giving the training to reuse and optimal use of PPE, where and how to use this. Okay. And then the reuse of N95 respirator also. So these points can be taken care of while we are talking about the cutting of the cost as a leader of the healthcare institution or as a hospital administrator. Okay. So last but not the least, because we are already running out of time and Dr. Sonali has already told me that I should be, So last but not the least, as a hospital administrator, see, data is very important. I'm teaching my students also. So you have to have continuous update of protocols based on World Health Organization, Center for Disease Control, that is CDC. Then we have Indian Council of Medical Research. Then we have Government of India guidelines. Every day rules are changing. Every day guidelines are being changed. So you have to keep an update, and you have to keep a check on data and scientific evidence. And you have to share it with all the people who are involved in the decision making, with all the people who are providing treatment to the patient. Okay, and so as to ensure the quality, not compromising the patient safety and the healthcare worker safety in your organizations. And I would say that this session was wonderful, and in future also we are looking forward for such sessions, so that the students can be, imparted with such training, and the information can be disseminated to them with the practical aspects, those who are working in hospital. Okay, thank you so much, Dr. Saloni, and thank you so much, Dr. Archana. Thanks a lot.
Yes, thank you, ma'am, for giving us a valuable insight into your session regarding the NABH and the accreditation process in the hospitals. And we would also like to share this knowledge with our students. Thank you, ma'am. We also request Dr. Philomena Isaac, ma'am, to give her valuable feedback for today's event.
Hello, good afternoon. Can you hear me?
Yes, ma'am,
Can
you
you
are
hear
audible. Yes, ma'am.
Yes, thank you, Dr. Saloni. We had a very nice session of our webinar, and we had these external speakers, the guest speakers. I must say that they have given us a very good insight into the whole COVID pandemic and the role of the hospital administrator. The first speaker, Dr. Rabindranath Biswas, he gave us a very good perspective into the healthcare services in the community and how we go about infrastructure planning and the administrative roles of the administrators. Now, since this webinar has been planned and done by the MHA students of Biosciences Institute of MGM, so it's very important for them to know how, as administrators, they can be very useful to the hospital healthcare services, and they are going to be administrators later on. So it's very important for them to know planning of hospital and understanding what are the priorities in managing, the various processes. And the second speaker also, Dr. Shyam Prasad, told us very good points of innovations and how they manage various problems and their improving protocols for improvement and innovations which they brought about. So ours is a little different setup. Ours is a medical college and it's a charitable organization. So our hospital has become a dedicated COVID center under the local civic authorities, that is the Panvel Corporation. So we have a dedicated COVID hospital here and a DCHC. So totally 250 bedded with 20 bedded ICU, and it's expandable to 350 beds also. And how we managed the pandemic from the start till now is really a journey of learning for all of us, of changing scenarios, as the speakers have mentioned, changing guidelines, changing ICMR protocols. Everything keeps on changing, the treatment protocols, the discharge protocols, the quarantine protocols, everything keeps changing over the period of time. So what we did was we had to have a COVID zone like all hospitals do. And definitely being a medical college, we have the non-COVID zone also. We had to kind of seal it off, completely seal it off from the non-COVID zones. Have the separate entrances, have separate screening protocols, everything like all hospitals do. And we merged up. Now the problem, what we faced was the shortage of staff, because with the pandemic, people were not, with the lockdown particularly, people were not able to come. So a number of nursing staff were not able to come, doctors, everyone, we had a lot of problems. Doctors, we didn't have much of a problem because it's a medical college. So we have enough of resident doctors from all faculties, all of them. So that's not a problem. Problem was with the nurses and the other paramedical staff, and the most important, the housekeeping staff and others. But what we did was we arranged transport from them from various pickup points. We bring them, take them. One has to look after the health, the healthcare workers. As much as you look after your patients, it's equally important to make sure that your healthcare workers are taken good care of. So those things are very important. And we also set up a task force. A task force is mainly all the faculties, the head of departments, and they form the task force. They do it on rotation duties. They are taking care of the isolation wards, the isolation ICUs, the COVID zones, the suspect cases, everything. And the best part of the communication is our WhatsApp messages, in which we keep on communicating about patients. They take their rounds, they take care of them. And it's not like a private corporate hospital. It's like, people, we maintain a social distancing between them. And we have an MOU with the corporation. So we take care of their medications, all the infrastructure, manpower, material, everything that's required. And so what we have done is we have a war room meeting on a daily basis. This war room meeting is presided over chaired by our director. Along with him is all these task force people and the HODs and the other administrative people. All of us get together and we discuss the problems on a day-to-day basis, and what problems we face, we kind of tackle it and keep on working for improvement. And this is one thing which the MHA students should learn, because they are working in our hospital on various projects. We have given them projects, and I'm very happy that they have put in a lot of work, and their enthusiasm is there. Even during our NABH work, they did a lot of work. And they learn by this about facing difficulties, facing problems. As Dr. Shyam Prasad also mentioned, that we learn from our problems and we try to improve on it, innovate. Each problem is an opportunity for improving. Okay, each mistake you make, each difficulty we face is an opportunity to learn and improve. So therefore, we wanted these students to help us, and I'm very happy that our MHA trainees are with us, many of them, and they're working in our hospitals. They are doing project works and they're assisting us in the COVID, as like the healthcare workers, they're helping us. Even with these project works like statistical reports, returns, we are supposed to maintain a whole lot of statistical reports, returns, which we send to the civic authorities. So they do help us with so many things. They are helping us with projects. And in every area, we can have, quality improvement, new indicators, just as Dr. Shyam said. So this is what we are encouraging them to do, and we will continue this. And I would like to tell you all that the most important thing is to have a teamwork and to motivate them. So when we had this pandemic, we did have all the same problems which Mr. Rabindranath Vishwas mentioned about people, having anxieties, apprehensions, stresses about their families and other things. So how we we organized stress management topics to train people how to deal with stresses. And the very important thing is administrators have to be an example themselves by taking part in by encouraging others, by helping them to allay their anxieties. So, and then managing affairs with a lower manpower. So that's how we kind of allied all our surgical services, our medicine allied services all together into different wards, try to reduce the non-COVID areas, scale it down a bit. So a little amount of improvisations and changes have to be brought about so that we manage the manpower, infrastructure, everything in a very proper way. Yes, there would be shortages of essential drugs and PPE kits and disinfectants and so many things that we require. So we kind of study it on a day-to-day basis and make provisions to have a proper stocking, reorder levels and things like that, and keep adequate stock so that we don't let the patients suffer, and the healthcare services also don't suffer. So once again, I compliment you all for organizing this webinar, and compliments to the MHA students also, all of them, and my good wishes to all of you. And thanks to all the speakers today. All the best. Thank you. Over to you, Saloni.
Yes, ma'am.
Thank you so much, ma'am. Thank you for your words that motivated us and also for sharing the scenario of MGM Hospital. Now I would like to call and I would like to request Dr. Archana Mishra to propose the vote of thanks.
Thank you, Tini. Thank you, Saloni, for this proposing me, giving me opportunity to give the vote of thanks. It's a really a very insightful session where we have a view from macroscopic to microscopic, and from application concept based to application based, practical based. We had our eminent speaker, Mr. Rabindranath Vishwas. Very difficult to call because I have been fondly calling him Robin. He is a proud MGM alumni, and he had also studied hospital administration in our own hospital. So he understands the technicalities of MGM hospital, and his speech was related to the macroscopic view, how healthcare as a system and how we as an individual budding healthcare professionals play our critical role here. Our second speaker of the day, Dr. Shyam Prasad, he has been a different connection with me. He is from Apollo. I had been ex-Apollo, so well, I came join in the last, but I welcome you, sir. Thank you very much for the insightful session. I'm sure the point which you have discussed with the students, they have a lot of takeaway, and when they will be working in the organization, I'm sure these quality indicators, the small minor changes what you proposed will be a very helpful tool for them when they will be they are already working now. And I think this is one of the rarest batch and very lucky students who got to work in a pandemic which comes after 100 years. So what Robin was also mentioning, that after swine flu, that is Spanish flu in 1920, now these students are really working, so they are going to be warriors. And our third speaker, obviously panelist, Professor Purnima Bhoi. She's Professor Purnima Gupta. She's my classmate and my friend from IHMR. She had her own role as an academician, a person who lead these budding healthcare professionals and give them the view in terms of how to see the healthcare, not as a profession, but as a passion. She is from KIT, leading university at Bhubaneswar, and I'm sure her student see this perspective through this webinar, that how they can implement when they will be joining the brigade, because this pandemic is going to stay for another 2 years, and we can see these healthcare professionals to work and leading from the front. Philomena ma'am has been always my inspiration because she's the youngest hospital administrator, medical administrator, and also now HOD of the MHA, along with Saloni Desai. She is my management colleague, so we keep interchanging our dialogues for management and healthcare, which goes hand in hand. What Philomena ma'am was highlighting, that we are a system teaching hospital where we have a role to not only cater to the healthcare, but also giving the lessons by research to these students who have to learn in this system. So understand the technicalities for a hospital administrator to guide these budding healthcare professional in the system where we have real life cases of pandemic situation, and what else a budding healthcare professional can expect from a system like that. So this webinar can give them a more insight how they can correlate what are the quality standards and how they can implement in the hospital. I would really say thank you to our MGM Trust for creating such kind of atmosphere where we learn by doing things. Our trustees, especially Dr. Kadam, and the hospital scenario where we have Dr. Narsetti sir as a dean, and medical superintendent Dr. Salgotra, who actually allow these students to learn. They never stop them that this is not your job. Rather, they are been the front to give them the projects so that they can learn by doing things. Our director, Dr. Mansi, I think she's the only person in the organization who never took a single day off, and rather took initiative to get the accreditation of NABL so that our SBS as a team can go for testing of pandemic, testing of COVID-19 cases. So she is a real leader for us. who has a good team like SBS, Dr. Minimol, Dr. Priyanka, Dr. Himanshu, and we have a team of very good committed people like Akash, Algappa Mama. Then we have Supriya, Rohit. So I can't be able to take everyone's name, but unless you have a team who is along with you, you can't just implement what you have in your mind. And since the pandemic has started, we understood the role of IT person. So IT and Anil, they go, synonyms in MGM. We can't say that we can run any program without Anil's help. So thank you so much, Anil, for organizing and supporting this team. We have housekeeping, our Mosi and Mama, they always help us. And I remember, even though the pandemic situation, they travel and they come every day, they are punctual. So all these things are required. We learn from everyone. We learn from housekeeping to the senior administrator, and I'm sure the kind of practical exposure and the concept-based learning we have in this webinar, together it will help us to rise as a good hospital administrator. Good luck to my students. I'm sure you will prove us, you'll make us proud one day that you are the one batch who has experienced this pandemic by doing and offering your services. Thank you so much. Thank you all visitors and attendees of this session. And I'm sorry if I miss anyone. Thank you so much.
Yes, thank you, Archana ma'am. Now, I'm sure that all the participants who have attended today's webinar would use all this gain knowledge into findings, their ways into the field of hospital administration. Last but not the least, would like to thank the entire SBS team for their support, Mr. Anil for the IT support, and I request a few minutes from all of us to send us your feedback for the event, and the link is being sent through email and the WhatsApp group. E-certificates for enrolled participants who have attended the webinar will be mailed to you by next week. Thank you all the student support of MHA team for making this webinar a grand success. Here we declare the end of the webinar, and stay safe, stay healthy. Thank you everyone.